Hi, I am Dr. Khurrum Shaukat Yusafzai, Hyperbaric Medical Consultant. Hyperbaric oxygen can treat about 300 diseases. It's a very common question on the minds of people that how a simple hyperbaric oxygen treatment can treat such a variety of diseases. So in today's video, I will try to explain the mechanism of action one by one to provide some answers. So let's begin. The ventilator and the hyperbaric chamber, they are both oxygenator devices, but the difference between two is very wide. The ventilator works at the normobaric pressure. The normobaric pressure means that the pressure equal to 1 atmosphere, and 1 atmosphere is defined as the weight of the air which surrounds the earth as a 200 miles shell. That weight is equal to 1 atmosphere, and that's the pressure which acts on the human body. So when a human body dives in the sea, it's a different story, because when you dive at 10 meters, the 1 atmosphere changes into double, that's equal to 2 atmosphere. So at 20 meter it would be 3 atmosphere, and at 40 meters it will be 4 atmosphere. So the pressure increases inside the sea. A hyperbaric chamber is kind of a dry submarine, that it pressurizes the human body mimicking the depth of the sea. But the beauty of the hyperbaric chamber is this: then when it exerts the pressure on human body, the solubility of the oxygen increases exponentially. So it can dissolve a lot of oxygen in the human body, which is equal to the pressure exerted. As the human body is 70% water, we don't even need the RBC or the red blood cells to dissolve the oxygen. And that's where the difference between the hyperbaric chamber and the ventilator arises. Because the ventilator working at normobaric pressure requires the red blood cells to transfer the increased oxygen which is pumped inside the lungs to be transported inside the body. And if there is some abnormality in the red blood cells, the ventilators won't work. The hyperbaric chamber is used in the medical field, and it works from 1 atmosphere to 4 atmosphere usually. But there is another kind of hyperbaric chamber called the diving hyperbaric chamber, which works more than the 4 atmosphere and up to 10 atmosphere and maybe more, depending on how deep the diver has dived. Hyperbaric oxygen therapy increases the mitochondrial function, and the mitochondria is responsible for making ATP from ADP. ADP is adenosine diphosphate and ATP is adenosine triphosphate. They are the energy blocks of the cells in the human body, that it increases the cellular energy level, and because of this increased cellular level, all the human body cells performed more. Since the immunity is made up of immune cells and they are also specialized cells, the increased mitochondrial function leads to increased immunity, which is about 300%. Because of this increased immunity, the human body has more immunity. The other mechanism by which hyperbaric oxygen therapy increases the immunity is by producing free oxygen radicals. And it also acts directly by fighting and slowing down the metabolism of the bacterial pathogens. Because of this, the effect on anaerobic and aerobic bacteria are seen, but the effects on anaerobic bacteria are more because of the increased effects of direct oxygen therapy. It also decreases the exotoxin release from the bacteria. For example, in the Clostridium bacteria perfringens of the gas gangrene. The hyperbaric oxygen therapy is also known to fight the drug resistance. It also enhances the effect of certain antibiotics, for example, the sulfonamides and the aminoglycosides. Their effects are increased 15 to 20 times. The hyperbaric oxygen therapy has also been known to decrease the growth of cancer cells, because normally everybody has about 1500 cells, cancerous cells in the body, but since they are not diagnosed cancer because the immunity eats them up all the time and it balances and keeps the body clean of the cancerous cells. With hyperbaric oxygen therapy, when the immune system is working 300%, it also reduces the growth of cancer cells. Hyperbaric oxygen therapy has been found to be anti-inflammatory in its effect. It does this by activating the anti-inflammatory defense mechanism of the body. Inflammation is caused by a certain biochemicals in the body which cause inflammation, and the hyperbaric oxygen gets rid of that and also activates the defense mechanism, and hence the anti-inflammatory effect kicks in. For example, the cytokine storm, like in the COVID disease, is also an inflammatory reaction, and the hyperbaric oxygen lowers the anti-inflammatory effect and keeps the body in good shape. Hyperbaric oxygen therapy also reduces the edema. The edema is reduced because of the vasoconstriction effects of the arterioles and the venules. Because of the vasoconstriction, there is increased resistance at the capillary level and also in the small blood vessels. Because of this, the escape of fluid in the body tissue is reduced, and hence the edema formation is reduced dramatically and very quickly. This helps in actually increasing the immunity and also the healing, because the increased edema can result in compression of the blood vessels and hence lower blood flow to the local tissue, causing very slow recovery and healing. The hyperbaric oxygen, when rapidly decreases the edema, the healing becomes rapid because the edema is stopped and also it doesn't happen. One of the very beneficial effects of the hyperbaric oxygen therapy is decrease in the keloid and the scars formation. Keloid and scar forms when the tissues are growing. When there is an injury, the tissue or the skin grows on the top of the wound, and when it approximates, there are electrical signals generated which tells the cells to stop growing. Sometimes this mechanism fails and the tissues or the cells keep growing. We call it keloid formation. So the hyperbaric oxygen therapy has been proven to stop the keloid formation, and because of the less keloid and scarring activity, the healing of the surgical tissues and flaps and grafts is very wonderful. That is one of the mechanisms of hyperbaric oxygen therapy. Stem cell activity. The hyperbaric oxygen therapy is one of the safest procedure to increase the stem cell activity. As you know, stem cells, therapy is an invasive therapy and it can maybe require a surgical intervention. But hyperbaric oxygen is a safe method where there is no surgical intervention required and it increases the stem cells. According to research and studies, the stem cell activity in the human bodies is increased to maybe 10 times or 15 times even with the hyperbaric oxygen therapy if taken for appropriate times. Hyperbaric oxygen therapy has been known to be epigenetic. Epigenetic means that any trait in the human body, for example, color of the skin or the secretion of insulin or whatever trait in the human body, or maybe the color of the hair. So any trait is actually controlled by two sets of genes, the good genes and the bad genes. When the good genes are working, you have the beneficial effects, and when the other set of genes, the bad genes, work, we have the bad effects or disease or a pathology occurs. Hyperbaric oxygen therapy has been found to increase the good effects of the alleles. So the good set of genes in the allele are activated and the bad sets of alleles are deactivated or suppressed. So that is one of the good effects of hyperbaric oxygen therapy. Because of the increased mitochondrial activity and the increased antimicrobial effects of hyperbaric oxygen therapy, and also increased in the stem cell activity, the overall healing of the human body increases 3 times in hyperbaric oxygen therapy. And that is one of the beneficial effects. Hyperbaric oxygen therapy stimulates anti-aging effects. How the aging occurs? The aging occurs because of the presence of superoxides. The superoxide damages the DNA, and because of the slow degradation or damage of the DNA, the aging process occurs and we have the gray hair and also the bad skin. The hyperbaric oxygen therapy activates superoxide dismutases. The superoxide dismutases are enzymes which get rid of the superoxides, and the superoxides are hydrogen peroxide present in the vacuoles in the cytoplasm of the cells. The hyperbaric oxygen therapy changes the hydrogen peroxide into H2O, water, and oxygen, which is very healthy and beneficial for the cell. So instead of the superoxide, hydrogen peroxide, which damages and degrades the DNA, we immediately convert it into water and oxygen. And that causes anti-aging with the hyperbaric oxygen therapy. Please subscribe to my channel by pressing the subscribe button, and also don't forget to press the bell icon to encourage our hard work and to see the highly informative videos about hyperbaric medicine. If you have any questions regarding the hyperbaric medicine, you can contact me via the apps scrolling down below. I hope to see you soon on the next video. So for now, bye and take care.